Hello and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe, Director of Professional and Community Education at Care Dimensions, and I'm so pleased today to welcome Patty Ramsden, who is our Chief Clinical Officer at Care Dimensions. And Patty's going to help us to understand, we're going to understand hospice and really talk about a lot of these myths and misconceptions. Patty, thanks so much for being on the show.
Thank you for inviting me, Mary.
Oh, we're thrilled to have you here. So tell the audience a little bit about yourself.
I am a nurse by trade. I have been a nurse for 30 years.
Wow.
And for context, I became a nurse when there were no jobs for nurses.
Ah, yes.
So
yeah.
that was a different time.
Sure was.
I've been at Care Dimensions for 10 years. I first came on to Care Dimensions as the Director of Admissions, and I have been the Chief Clinical Officer for the past 3 years.
Oh, that's fabulous. Well, we're thrilled again to have you here. So, and I love talking about this topic because there are really, even now, a lot more information has gone out so that people can understand hospice better, but there's still a lot of misunderstandings around this. So I want to just clear up a lot of those for our audience today. So, Patty, tell us a little bit about, sometimes people think that hospice care is for people that really have just days or weeks to live. What would you say to that?
Yes, and I can see how people may believe that because a lot of folks, when they come on to hospice, they do only live for a few days or a few weeks. And that is simply because they either were not referred to hospice or they were frightened to come on to hospice. But patients have 6 months or even more than that to come on to hospice. So there is a benefit under most insurance plans that does cover that. And they have they're entitled to all of that time, so it's hard to squeeze everything hospice does into just a few days or even a few weeks. So the sooner someone comes on, the more they are able to benefit from the services.
Absolutely, and I think that, again, people can be on for an extended period of time. It's just this misconception that people have of this. And like you say, the longer they're on, the more they can get in terms of being tended to. Their physical and emotional and spiritual well-being can be addressed.
Yes, I think if you think about it, the relationship someone has with their doctor is much different than the relationship they might have if they went into an emergency room.
Right.
So when people come onto hospice with just a few days, it's almost like that crisis intervention, like you can imagine an emergency room would be.
Yeah.
But when they come on early, then they have the time to develop that relationship like they would with a trusted physician. That's
really a great way to put it. I think that's really helps people to understand. I think another thing that people think, well, they worry, oh, well, if I go on to hospice, I can never come off of it.
Oh yes, I know. They think it's such a permanent decision.
Yeah.
But indeed it is not. Yep. People always remain in control of their care, and they can decide to come off of hospice, and they don't even need to give a reason. They can just simply say, I'm not interested any longer. And then also, if they decide later on in time they're interested in coming back or they need to come back, they can sign back on to hospice care. So they're always in control of what they do. It's not a permanent one and done situation.
Yeah, what I've seen so much over the years, Patty, is that sometimes people are hesitant. That it's that old adage, it's too soon before it's too late. And they wait and they wait and they wait, and then when people finally come onto hospice, I hear it time and time again. We wish we had done it sooner.
Yes, we wish that we had had access to all of that great support for the patient, but also for the family. All that great support for the loved ones that are caring for that patient. They really wish they had known about it sooner.
Absolutely, and I think that's another one of those misconceptions because, when they have a life-limiting illness, they're at end of life, people think that this really is just about the individual. It's about the family as well, and family being whoever loves and supports you. So there's a lot of support for that whole family system, isn't there?
Yes, there is a lot of support, and a lot of times I think people don't realize that. They're very accustomed to the traditional medical system where the patient is the focus. Maybe when you go into your doctor's visit, you might be acknowledged or you can ask a question, but with hospice care, we're really focusing on that unit and how they function together. So I think for a lot of patients, they feel comfort in that, knowing that the support is helping their family as much as it's helping them. So it's very unique in the healthcare world that we're treating them as a unit.
Which is wonderful, and it's very necessary. Sometimes people feel too that, that they have to, in order to come onto hospice care, that they have to be what's called a do not resuscitate. So can you talk a little bit about that one?
Yes, that is a tricky one, and simply, I think, do not resuscitate, I think those words are very loaded, or this frightening DNR, you know, when someone says, are you DNR,
Yep.
you know? So it simply is not true that people can come on to hospice care not having made that decision yet.
Yeah.
You know, and often I think people haven't made that decision because they don't truly understand it.
I agree.
That in the healthcare setting, we've simply not done a good enough job on the other side to help people understand that, you know, when you have an illness that's progressing, that it's not going to be a good outcome if you were not a DNR. So we take people as they are, and we help them to understand it, and we explain it. But it is simply their choice. And most folks, as they progress and get to know us a little bit better, have that trust and understand that this might be something that it's important for them to have, so their wishes are honored.
Yeah, excellent. I think that's really important for people to understand. You know, and you did talk about this a little bit already, and I think that it's wonderful that you're bringing up this point that people worry. They worry about that if they're coming onto hospice, that they're relinquishing control of their care. Really, they're doing just the opposite, aren't they?
Yes, I mean they're gaining control or regaining control of their wishes, and the hospice team is the perfect audience to help you make your wishes come true, you know, as far as how you want the time you have to go. And I feel like it gives people permission to talk about it before we come onto the picture. Often it's something that patients and families don't talk about with each other. Right. And having hospice there, you know, trained people that have gone through these types of situations, it allows that conversation and those wishes that patients are really wanting to come true. It allows that conversation to happen.
Yeah, it really, that's what I love. There's so many things I do love about hospice and palliative care, but one is that, again, how they focus on the patient and the family in terms of really making sure that their goals, their preferences are elicited, that they're at the center of everything.
Yes, and it's so individual.
Yeah.
So it's not one size fits all. For patients and families, it's really taking into their unique situation and really developing that relationship so we know what's important to them, and then helping that to come to fruition.
Yeah, and sometimes people think that, right? That it's just one size fits all, like it's a cookie cutter approach system. Not at all. Everybody's individual, you know, how their disease unfolds, their experience, their journey, very unique to them. So, and also the family as well. So there's no cookie cutter approach with them as well, right?
No, absolutely not. We want, even if you can take two patients that are exactly the same and they're going to be so different.
Yeah.
So we're really looking to find what is important to that patient and that family. What are their goals? What are their objectives? And those things, as you said, when you come on, the sooner you come on, the deeper that the hospice team can get into that, type of situation and help them have a great quality of life.
Yeah, that's and you talked about this kind of way, and advanced illness, dying. It can be so medicalized, but it's about more than that, right? And that's again one of those focuses of hospice care that I love so much. That it's looking at the person, and that's why when I brought up the spirit, mind, and body, it really tends to that whole person and making sure that all of those needs are addressed. And you're not always finding that everywhere in healthcare.
No, I think you're not, especially these days. After the pandemic, we found that waits can be a little bit longer at doctors' offices, and maybe people have staffing problems. So people are not perhaps getting the attention they got in the past. So at end of life, it's so important to have that individualized attention, and that's what the hospice team can give you. And there's professionals on that team, the nurse, the social worker, the spiritual counselor, the health aide, complementary therapies, all ways to address the person as a whole person. And there's no rush to accomplish that. When you go to the doctor and you get there for your appointment, and you only have a small amount of time, you have to rush your questions.
Right.
Invariably, when you go home, you think about all the things that you didn't ask because you were nervous or you didn't have the time. With hospice, coming on sooner and having that team in place really helps that patient to not have to worry about those questions and those needs. You know, you always have access to your team.
Absolutely. Yeah. You know, another thing that comes up for people too is, or people think that when you hear the word hospice, it's really just for individuals who have cancer. So let's talk about that myth.
Yes, I know. As many types of people there's many, you know, illnesses or diagnoses that people face at the end of life. So we have to, once again, treat those all differently. If, say, you had a young patient with cancer and then you had an older patient with dementia, those two patients are they're all going to need hospice and they're all going to approach end of life, but their situations are so different. So we are trained, our nurses and our teams are trained to take care of all kinds of folks and all of the things that go along with the different illnesses. So although cancer is, you know, it is high on our list of diagnoses, many different diagnoses are included, and we're well equipped to take care of all of those patients.
And it doesn't preclude you, because sometimes people think, oh, I don't have this diagnosis. It's not the it's really about, you know, is your status, is it a life-limiting illness, all of that, are you meeting the criteria to come on? So it's not the diagnosis that would keep you from being able to come on.
No, absolutely not.
And the other thing I wanted to bring up, because you know, bringing up you know, Alzheimer's or related dementia, I think it's important that we do expound a little bit on that here, because a large portion of the patients that we serve do have Alzheimer's or related dementia diagnosis, and we're going to see that grow and grow. So it's very important, because I think some people think that that's not, you know, how that's not a diagnosis, dementia not being a diagnosis, but Alzheimer's or a related type of dementia, that would not warrant their being on, and that's not true.
No, it is not true, and we are fortunate enough to have wonderful doctors at Care Dimensions that can help to review patients' information. Even when things don't look as clear as they could be, our doctors can review them and examine and look for those things that would help somebody fit criteria to come on to hospice care.
Absolutely.
So that is an important point to bring up. I would encourage people not to worry about what diagnosis it was, but more what's going on.
Yeah, absolutely. And once again, boy, is that care needed for everyone involved, everybody involved. So a lot of times people also feel that you can only receive hospice care in a hospital or in a hospice care facility.
Oh yes, another myth. So the majority of our patients receive care outside 4 walls of facilities. So most patients are in the community. They're living their lives in their homes. They're living lives in assisted livings, in group homes, sometimes in skilled nursing as residents. So the majority of patients, that's where they are, and many studies have shown that's where people want to be. They want to be outside of the medical institution. They want to be with as long as they can, if they're able to be with their loved ones and their familiar surroundings.
So anywhere the person calls home. I once had a patient say to me, okay, I'm ready for hospice, where do I go? I said, oh, no, you don't have to go anywhere, we come to you. So, so that people understand, anywhere you call home, hospice can come to you.
And I think that is kind of a unique, these days we, patients, and we go everywhere for our health care. Our health care doesn't come to us typically.
Absolutely.
So it is sort of a unique situation, and people really, I feel like, love that. The idea that I don't have to get out to an appointment anymore. I don't have to worry about if I'm dressed. I don't have to worry about if I feel good or someone can bring me, that folks come to them.
And although, like you say, even though a lot of the people that we're caring for are in their home setting apartment or with a family member, that there's many that are in assisted living, skilled nursing, that sort of thing, and sometimes they're not realizing how I didn't think I could have that care too. It's a compliment. We're bringing in expertise in.
Yes, absolutely. So our hospice care is always complementing and supplementing our care plan, and so our goal is to help teach those folks that are at the center, the family, maybe some private care providers like assisted living folks or private pay folks. So our job is to be additive and help everyone to really, when we're not there, to be feeling skilled and comfortable taking care of that patient.
Yeah, absolutely. Now another one too, people think, and I've had people say this to me, I can't do hospice care because I can't afford it. They think it's expensive.
Yes, I feel like I feel like not to stereotype on the older generation, but people are very focused on that. And I think it's important, and we do a good job at talking about this is a benefit you have. It is covered under your insurance. Almost every insurance has a hospice benefit, and we do a good job at looking at the benefit so people know when they come onto service, this is all covered. You do not need to worry. You know, the care that we provide is 100% covered. You will not get a bill. And I feel like that's really reassuring.
Absolutely.
And I feel like people understanding it's a benefit and something they've worked for and they deserve is also really important.
Yeah, and I think that point we need to drive home, right, is that it's a benefit that you are entitled to, and that people, people should, actually access this benefit, and I think that they don't understand it that way.
Yes.
So, and they're not going to get a bill. And so let's talk a little bit under this too, in terms of, what is covered, because in terms of the team visits and all of that.
Yeah, so it's a very generous benefit in that all the folks that visit, part of that hospice care team, all those visits, so nursing visits, health aide visits, social worker, spiritual counseling, even hospice physician or nurse practitioner visits are covered. We're also lucky enough to have music therapy. We have pet therapy, we have Reiki. We also have pharmacists on staff that can consult regarding medications. So all of those things are all covered. So those physical people that are part of the patient's care, in addition to their trusted physician. So they do not lose their physician. Their physician is still working with us. So all of those people are covered, as well as medications that are related to their illness and for comfort. Those are all covered, and those are delivered by a pharmacy that we contract with, so they bring them right to the house as well. Also, any medical equipment, things like a hospital bed, walkers, wheelchairs, anything like that, is covered and delivered to the home.
Nice.
So these are things that are all part of that hospice benefit and are all brought right to that patient's home in order to make things as easy as possible for the patient and family.
Excellent. So two things I want to talk about that you brought up there that I think are very important. The physician, their primary physician, because you know what? People worry about it. And even some of the primary physicians think, oh, I'm not giving up my patient. You're right, you're not. So, and some of the patients worry that if they go on, that they lose that connection with the primary. That's not true either.
Yes, it is not true. So the attending physician, whoever the patient, so the patient chooses who they want to be their attending physician. Sometimes it's their primary care, maybe it's their oncologist, maybe it's their cardiologist. It's whoever they choose. That includes a nurse practitioner, a physician assistant. Those can be chosen as well if they have the relationship. So they are chosen, they remain involved, they're kept updated by the care team. They still sign all of their orders and their medications. We have a hospice physician that is involved as a collaborator. So they collaborate with the patient and family, also with their primary doctor. They can collaborate with them. So it's just really increasing the team that the patient has, but always keeping their doctor as part of that team.
Which I think is extremely reassuring to them, because again, there's been a connection for so many people for such a long time, and they want to maintain that, and that we absolutely support that wholeheartedly. The other thing that you brought up when you were talking too is you were talking about complementary therapies, and and I think it's worthy of just touching on again, because complementary therapies are just that, a complement to traditional medicine. And you brought up about music and Reiki and massage and all of that, pet therapy. This, and I do like people to understand not all hospices have this. We do, and we understand that this promotes well-being.
We do, and we have paid staff for massage and music. That we think it's important enough that we employ people. We also have volunteers that do our pet therapy and our Reiki in addition. So these are some of the most popular services, as you can imagine. Who wouldn't love a massage therapist to come to their house, or music therapy, and they're just wonderful people that help the patient to look at something other than their medical condition. They can look at things like touch, like music, like, patting, a dog. Who wouldn't love that, right? Someone that might due to their circumstances, have not been able to have a dog, and having, you know, a pet visit is just a wonderful way to get out of their everyday.
Right. And that cost is not passed on to the patient, and I like people, or the family, I like people to understand that too. But that's a question people should be asking, because again, they think that everybody has these things. They not. Not all hospices are alike, so you got to really understand that, right?
Absolutely. I think it's always good if someone's referred to hospice from their physician. I always think it's good to, you know, interview that hospice and ask questions, and even maybe compare a few, just see what they have to offer, because just like patients' care is individualized, those hospice agencies are all different, and they'll offer that basic core benefit, but then those additive things are going to be different. So you always want to ask questions and make sure that that's the best fit for you and for your family.
Yeah. Because another distinguishing feature is too that, again, when we were talking about places, we happen to have 2 licensed inpatient hospice facilities.
Yes, we're very fortunate to have those 2 facilities, and so they can be used in a variety of ways. So take, for instance, you have a patient at home, and there's a crisis in the family. Maybe the caregiver needs surgery themselves. We are able to access our inpatient units to do respite care, which the patient is entitled to, 100% covered under their benefit. So 5 days of respite care are covered. And so that really helps take the burden off the family for things like unexpected things, but also for things like planned events, like weddings or, you know, vacations or graduations. It really gives that patient a backup plan if those things occur. We also, if a patient develops a symptom that is hard to manage in the home setting, you know, say some uncontrolled pain or something like that, we can use those houses for short stays for the patient to come and get those things under control, thus avoiding having to go to the emergency room, you know, if things get a little bit tough at home. So we have some nice safety net plans, and that's another great reason to come on a hospice soon, so you can have those things in place if and when you need them. Not everyone needs them.
But understanding too, it's a distinguishing view that not all hospices have those.
They do
so
not.
Those are questions to ask, and make sure that you understand that. A lot of times people think that hospice is really just for elderly or older adults. What do you say about that?
Yeah, all ages from you know, 1 to 101. You know, we take care of pediatric patients. Of course, incredibly, you know, tough for people to think about, but it's wonderful that we have the ability to do that with trained experts, even a pediatrician on staff that can do home visits. Our hospice houses, those places we were talking about, also can accept children if needed. So we are specialists from birth to the end of life. So depending on what, you know, what is going on with that patient, but our staff are really, it's not, you know, it's not just for, you know, an older adult. It goes across the spectrum.
And sadly, death is not a respecter of age. So it's necessary to have this quality type of end-of-life care for all involved.
Absolutely.
How about the, you know, one of those other big myths is that being on hospice actually hastens a person's death.
Yes, that's another one that we hear. And I think it equates to when people come onto hospice late in their illness, that they may only live a few days. And so it's easy for people to think, oh, they came onto hospice and they died in a few days, when it was really, you know, coming on late, and it wasn't anything that the hospice did. It wasn't adding in medications that hastened. It was that illness was at an advanced place, and so they came on. So nothing we do is designed to hasten death. We're really just looking at symptom management. Sometimes with that management, it may cause a little bit of sleepiness or things like that, but we're really trying to balance that and take into account the patient and the family goals. But 100% not. The goal is not to hasten death.
Not at all. And as a matter of fact, and I always like to share this with people, is that the studies show that actually people on hospice care live longer.
They do more well managed with their medication.
That's right.
Socially, they have more access to people coming in and out and being on top of things when they happen.
That's
so
right.
Yes, you're 100% right.
And those are the two main reasons, just what you said, is, you know, and so I think that can help to people to dispel that myth and misconception around that. How about, people think that hospice care ends once that individual passes away or dies. What would you say to that?
Yes, I would say we are all, once again, fortunate we have a great bereavement team. We actually have a center, the Bertolone Center for Grief and Healing, and we have a wonderful team of social workers, licensed mental health counselors, and those folks follow up with families after the patient dies for 13 months. So we go through all of the different events, from over that 13 months and culminating in the anniversary of the death. So even when someone passes away, they can feel rest assured that their family is getting the support, or friends, any of those folks, to support groups, to counseling, to resources, really focusing in on how can we help them cope with the loss of their loved one.
Yeah. And if people, just as you mentioned, the dying experience is unique. It's a personalized journey. So is the grief journey, and people will actually, in that, it's going to be varied for people. So if people need to receive that type of support long after that 13 months, it's there for them, isn't it?
Yes, it is, absolutely. And also before somebody passes away, we can help with anticipatory grief. You might have a particularly complicated situation. You might have young children in the home.
Right.
And we are lucky enough also to have child life specialists who can help young children deal with the expected death of a parent or a loved one. So
which is so important.
Yes. Very.
Children, they grieve. Sometimes we think that they don't because they don't talk about it. They grieve too. They just do it differently. So important to make sure that that support is there. And I'm glad you talked about that anticipatory grief, because it's very much there. Sometimes people think that if it's a long illness, that their anticipatory grief, that that the work is done. Sadly not.
Yes, not. So we're always looking at that. We're assessing our team is letting our bereavement folks know if there's a situation like that we can help to start that process prior, so it'll be just a little bit easier.
Excellent. Well, I know we kind of need to wrap. I can't believe how fast the time goes, Patty. I could sit here and talk with you for hours, but just if there's any other last things that you want to say, or ways that hospice can really make a difference for a patient and family, things that you can think of. I mean, we talked a lot about this already, but I don't know if there's anything else you feel like is left unsaid. But
yeah, I mean, I guess I've been doing hospice for 18 years, and it's the same old thing, just taking away those stigmas about talking about end of life and talking about wishes. We do a lot of talking about when a baby comes into the world, about a birth plan.
Yes.
But we don't do a lot of talking about a death plan.
That's right.
About what somebody would want. And I think as different generations come up, I think they'll probably be much more engaged, and the taboo will be taken away. So I encourage people to have these conversations with your loved ones, no matter what age. Make sure your wishes are known. If you can put them down in writing, I think it's really important, but don't wait until you get into a crisis situation. Try to do that planning ahead of time when you're feeling good and healthy.
Excellent. Well said, Patty, and thank you so much for being on the show today. We really appreciate your time and your expertise.
Thank you for having me.
Well, thank you, everybody, for joining in on today's program, and we look forward to you joining us for other Timing is Everything programs.
A lot of people think that hospice is bringing somebody on in the last few days of life, and that may be true in some instances, but we really like to be able to bring people on a little bit early so that they can really benefit from our whole interdisciplinary team.
Hospice really is a supportive services that can really help enhance the quality of life for patients and families. And that, again, it helps to give them a little bit more control over a situation that they may not necessarily feel in control of.
We focus on comfort, and we focus on allowing patients to spend the time enjoying their lives, doing the things that they enjoy.
You literally just pick up the phone and call them and they answer. Or if you, even in the middle of the night, I tell families, if you need somebody, you have a question, you're unsure about something, call. You're not bothering anybody. There's always somebody available.
Because we are expert, we know what to do, this is what we do to help people. If you are going through something there and you need help, we are here to help, and we are very good at it.